It's Nate Humphrey, and today we'll be talking about liver cancer. Overview: liver cancer is a cancer that begins in the cells of your liver. Your liver is a football-sized organ that sits in the upper right portion of your abdomen, beneath your diaphragm and above your stomach. Several types of cancers can form in the liver. The most common type of liver cancer, hepatocellular carcinoma, I'll put that on the screen, which begins in the main part of the liver cells. Other types of liver cancers, such as, I'll put those on the screen. These are much less common. Cancer that spreads to the liver is more common than cancer that begins in the liver cells. Cancer that begins in other areas of the body, such as the colon, lungs, or breasts, and then spread to the liver is called metastatic cancer rather than liver cancer. This type of cancer is named after the organ in which it begins, such as metastatic colon cancer to describe cancer that begins in the colon and spreads to the liver. Or what are some symptoms you may experience if you have it? Most people don't have signs and symptoms in the early stage of primary liver cancer. When signs and symptoms do appear, they may include weight loss without trying, loss of appetite, upper abdominal pain, nausea and vomiting, general weakness and fatigue, abdominal swelling, yellow discoloration of your skin and the whites of your eyes, and white and chalky stools. When to see a doctor if you are seeing any of these symptoms, or you may know someone that has some of the symptoms, just contact your healthcare provider, and if you have any questions, comments, concerns, just let them know, and hopefully you guys can figure something out, like a checkup or something like that. What are the causes of this? Liver cancer happens when liver cells develop change or mutations in their DNA. A cell's DNA is the material that provides instructions for every chemical process in your body. DNA mutations cause changes in these instructions. One result is that cells may begin to grow out of control and eventually form into a tumor. Sometimes the cause of liver cancer is known, such as with chronic hepatitis infections, but sometimes liver cancer happens in people with no underlying disease and not clear what causes it. What are some risk factors? Factors that increase the risk of primary liver cancer include chronic infections with HPV or HCV, chronic infections with hepatitis B virus or hepatitis C virus increase your risk of liver cancer. Cirrhosis, I don't know if I'm saying that right. This progressive and irreversible condition causes scar tissue to form in your liver and increase your chance to develop liver cancer. Certain inherited liver diseases that can increase the risk of liver cancer include hemochromatics and Wilson's disease. Diabetes. People with blood sugar disorders have a greater risk of liver cancers than those that don't have diabetes. A non-alcoholic fatty liver disease. An accumulation of fat in the liver increases the risk of this type of cancer. Exposure to aflatoxin. Aflatoxins are poisonous products by molds that grow on crops that are stored poorly. Crops such as grains and nuts can become contaminated with aflatoxin, which can end up in foods made of these products. Just be careful when you're working with crops and grains and nuts. I can put some on the screen just so you guys or I can try to find some for you guys so you kind of know what to look for so you guys can be safe. Excessive alcohol consumption. Consuming more than a moderate amount of alcohol daily over many years can lead to irreversible liver damage and increase your risk of liver cancer. Preventions. Drink alcohol in moderation, if at all. If you choose to drink alcohol, limit the amount you drink. For women, this means no more than 1 drink a day. For men, this means no more than 2 drinks a day. Maintaining a healthy weight. If your current weight is healthy, work to maintain it by choosing a healthy diet and exercising most days of the week. If you need to lose weight, reduce the numbers of calories you eat each day and increase the amount of exercise you do. Aim to lose weight slowly, 1 or 2 pounds each week. Get vaccinated against hepatitis B. You can reduce your risk of hepatitis B by receiving the vaccine. The vaccine can be given to almost anyone, including infants, older adults, and those with compromised immune systems. Take measures to prevent hepatitis C. No vaccine for hepatitis C exists, but you can reduce your risk of infection. Know the health status of any sexual partner. Don't engage in unprotected sex unless you're certain your partner isn't infected with HPV, HCV, or any other sexual transmitted infection. If you don't know the health status of your partner, use a condom every time you have sexual intercourse. Just be safe, dogs. That's all you gotta do, dogs. Don't use IV drugs. If you do, use a clean needle. Reduce your risk of HCV by not injecting illegal drugs. But if that isn't an option for you, make sure your needle you use is sterile and don't share it. Contaminated drugs paraphernalia is a common cause of hepatitis C infections. Take advantage of needle exchange programs in your community and consider seeking help for your drug use if you have drug use. I'm not saying you're a druggie or anything. Seek safety, clean shops when getting a tattoo or piercings. Most of them I think will say if they're, most of them will do it. Most of them, unless you get it like under the table, I think most of the shops like change out. I know the tattoo shop I go to, they clean out. They use new needles every time. So just be safe, dogs. That's why I make these videos, dog. I'm not a doctor by any means. I just like to spread awareness for you guys. My story is I write music. I make videos for you guys. I do a whole bunch of stuff. So guys have any questions for me, just let me know down below or just email me. I know you might not know my email. Just comment down below and I will get your email or anything like that so you guys can communicate with me if you need it. Ask your doctor about liver cancer screenings. For the general population, screening for liver cancer hasn't been proved to reduce the risk of dying of liver cancer, and it isn't generally recommended. People with conditions that increase the risk of liver cancer might consider screenings, such as people who have the hepatitis B infection or hepatitis C infection or liver cirrhosis. Discuss the pros and cons of the screening with your doctor. Together you can decide whether screening is right for you based on the risks. Screenings typically involves a blood test and an abdominal ultrasound exam every 6 months. Alright guys, I hope you guys enjoyed. If you did, make sure you give it a thumbs up. Hit that subscribe button to post notifications so you don't miss out. If you have any questions for me, let me know down below. And if you have any questions for your doctors, just let them know by emailing them or calling them. I love you guys. Stay safe. I will see you in the next video.